When we think of issues in health, we often think we're turning to medics and the Medical Research Council. They have a huge role and a huge amount of funding to look after people's health. But there are many other contributions that can be made by partners in areas like the arts and humanities. So today we've brought people who've been funded by the Arts and Humanities Research Council together at the Crick Institute to look at some of the impacts of their research. What is it that they're doing that's really contributing to improve clinical practice, to improve the lives of dementia sufferers, to think of ways in which patients are benefited from the sorts of skills and capacities that we have in the arts and in the humanities to bring that research to people's lives?
My name's Cathy Treadaway, and I'm Professor at Cardiff Metropolitan University, and I'm the Research Director of Hug by Laugh. And I've brought with me Hug, and Hug is something that we've developed through our AHRC-funded Laugh project. And the Laugh project, the key aim of the Laugh project was to develop playful handheld objects for people living with advanced dementia. And one of those devices was Hug. And Hug was made for a lady called Thelma, who lived in a care home in South Wales, who was on end-of-life care. And we developed the prototype Hug and gave it to her, and it clearly gave her comfort instantly. But when we went back after 3 months, the change in her was phenomenal. She was up and out of bed, and she was socialising with other residents. And even more astounding was that she lived with a good quality of life for a further 9 months.
So the Intercalated BA in Medical Humanities is a 1-year elective degree that we teach to our medical students at the University of Bristol. And it consists of English literature and philosophy. And it gives students a kind of different way of learning and a different way of thinking that isn't based on lots of information and facts, but rather on more open-ended and speculative work that they do with us. And this seems to offer them, or does offer them, by their own account, considerable benefits in their work as clinicians.
So the Branching Out project builds on eco-capabilities, which was also funded by the AHRC, which looked at how we can support children's mental health and well-being through arts in nature practice within schools. We were concerned about the increasing problems with children and young people's mental health, and the fact that schools were increasingly expected to support those children, but with few resources to do so. So trying to think about how we can build capacity for schools and support teachers, teaching assistants and head teachers to support the children and young people in their care.
I'm Christina Victor from Brunel University, West London, and I'm representing the Enliven project. The Enliven project is setting out to engage people with dementia and their carers in the visitor economy, so enabling people with dementia to visit the kinds of visitor attractions that we take for granted, such as national parks or royal palaces, local activities in their community.
Arts and humanities researchers bring a huge diversity of approaches, skills, resources, methods, which I think are really key to tackling some of these major health and wellbeing challenges that we face in society. The huge volume of numbers of users, things like waiting lists, things like access to services are a real challenge, particularly for people living in the poorest areas. Arts and humanities scholars have real expertise in thinking about how best to solve those complex problems.
I suppose going forward, what we really need to ensure is a sustained funding for arts and humanities-led research, but also to think innovatively on how that research can be scaled to meet national priorities like tackling health inequalities. Across all of this, we need to ensure that the creative method helps bring communities, community engagement, the voices of those with lived and felt experiences, and put them and embed them really at the center of the work that we've seen today and moving forward.